afternoon, everyone. This is Leanne Bryan from the National Center on Subsidy Innovation and Accountability. Thank you for being with us this afternoon. We are going to go ahead and jump in. It's 3 o'clock. We have our second National Program Integrity webinar today, and we will be focusing on fraud prevention, detection, and investigation. And we're also very pleased to have Delaware and Georgia with us this afternoon. They're going to be sharing some of their strategies with us related to these fraud topics. I don't know if I can get my slides to move. There we go. So a few housekeeping items before we dig into the content. If you've been on our webinars before, you know that we do strive to keep them interactive, and we will stop throughout the presentation for questions and answers. But I'll also say that we have a lot of content to cover today. So instead of stopping throughout the presentation, we may wait, we'll keep an eye on the time, and save the open discussion for after Delaware and Georgia have an opportunity to share their strategies. But we definitely plan to make sure there's time to do that. We just may not break so much throughout the discussion today. If you are using your phone to call in, which we encourage, it's usually more clear, you do need to enter that individual audio PIN number in order to be heard. So lesson learned, just some of my personal experience, if you didn't enter that PIN number already, you're probably going to need to hang up and quickly dial back in and enter that PIN number. Again, that's just so that you can unmute your line and we can, be able to hear you talk during the interactive discussion. If a question does come to your mind throughout the presentation this afternoon, you can either raise your hand and we'll call on you during the first break, or you can also type your question into the questions panel. And then when we do pause, we'll be able to get to that question and hopefully have a discussion and respond. If anyone should have any PowerPoint or GoToWebinar issues this afternoon, please feel free to reach out to Katie Watt. Her email is displayed there on the screen, but in case you're having issues seeing the screen, it's kwatts@wrma.com. So here are the presenters from the Subsidy Center today, and actually we do have a slight change. That's me on the left, Leanne Bryan, Program Integrity and Error Rate Manager. In the middle is Janae Broadway. Janae comes to us from Louisiana, and she is our Program Integrity Specialist and Subject Matter Expert. And over on the right is Brad Kramer. Brad is a Senior Technical Manager and also our Information Technology SME. Brad, unfortunately, has been having some technology issues of his own this afternoon, specifically audio issues, and likely will not be able to join to help present, but we'll give it a shot and we'll see how it works. Now for a welcome message from the Office of Child Care, I'm going to turn it over to Dr. Ellen Wheatley.
Thank you very much, Leanne. Welcome, everyone, and happy afternoon to you. I'm really excited about this particular presentation. As a state administrator, I can tell you one quick story about how this is all so important. We were doing just random looks at invoices coming in from providers because our computer system didn't give us very much information. And we came upon one where a weekly invoice for a 9-year-old included full day, including a holiday day. This was way back when you could actually do, holidays we don't pay for. It's a bad thing. So I hope you're not doing that. But what was really interesting was that there was no way that in the middle of March, a 9-year-old was doing all-day work, all-day childcare. So we did an investigation and found that this provider owed us $80,000 back because she had been doing all-day care, invoicing, including holidays, for over a year. So with that information, we were able to go to the computer folks and say, we know you've been ignoring us for a few years regarding the issue of fraud, but I think you'll really see it our way after you look at this particular case. And they did. So we were able to get red flags that we wouldn't even have to pay because the invoice would just be rejected if during school weeks a school-age child was full-time. So, and all kinds of other red flags followed that. Rather than just having the random look at things, what's very exciting about this presentation is the toolkit. Well, that and the wonderful presenters, but the toolkit is so much better than anything else I've seen. Rather than, and I'm sure you've had this kind of toolkit where the analogy would be, okay, to make a cake, you need some flour and some eggs, and then you need to put it in an oven and you have cake, and you go, I don't know how to do any of that. You don't give me enough information. Well, this is the type of toolkit where you get to know how much flour, how many eggs, all the other ingredients and their proportions, the temperature of the oven, and how long to leave the batter in there. It's A through Z, and you're going to be able to take this right from the page and into your program and make some significant improvements in fraud prevention and detection and investigation. So I will turn you back over to Leanne and say that I really hope you enjoy the presentation. Take care.
Thank you so much for that, Ellen. And I'm really happy to hear you, have some good thoughts about the toolkit. I know Brad has worked so hard on that, and we're excited to continue to develop. In the handouts, everyone, there are the 2 pieces of the toolkit that Ellen mentioned. We will demo those in a little bit, but we have more coming. There's more coming when we talk about the fraud toolkit, but we'll get to that in a few more slides. So the agenda for our time together this afternoon, we do plan to discuss that fraud risk assessment tool and demo the prevention section of the fraud toolkit. I actually have both pulled up so we can take a look at both of them just in case they are new for some of you out there. We'll also talk through strategies for fraud prevention, detection, and investigation. And one of our, biggest thrills for this afternoon is hearing from Delaware and Georgia, real estate strategies and what's happening out in the states now. And of course, as I mentioned before, we'll make time for questions and open discussion, but maybe not towards the end of the session. Then we'll wrap it up with what we expect next. But before we dig in, I did just want to mention something that I had put in an email yesterday, but in case anyone didn't see that, or just to remind everyone, this is what we're planning on, sort of part 1 of a 2-part webinar series. So today, as you can see here, we're going to talk about fraud prevention, detection, and investigation. Our plan is for a future webinar, possibly in June, is to get into that next piece. So the appeal process, preparing for a hearing, and then recovery enforcement. So today, again, kind of think of it as part 1 of a 2-part series. We'd love to hear your feedback, maybe during the evaluation, just if there's any specifics that you would like to know for the second part of this webinar today. All right, so now we're going to get into the meat of the discussion here. And first, we're going to lead off with a refresher of the fraud toolkit. So again, kind of for those of you who haven't seen it, it has been out for about a year now, but NICSIA, the Subsidy Center, in coordination with the Office of Child Care, designed the Fraud Risk Assessment Tool, which is for lead agencies to assess their risk level. So after the lead agency answers 20 questions, a risk summary is provided on a result summary tab. The assessment tool is really designed to identify risk areas, but then kind of as Ellen indicated, it includes recommended steps for improvement. So we're trying not to leave you hanging, but if you happen to score as high risk, we're going to give you feedback about that and how to improve your program. The prevention section of the fraud toolkit was just recently finalized about a week ago, and those categories of assessment include prevention, well, of course, it's about prevention, program administration, case management training, and verification strategies. So again, those two tools are included in the handout that you can download now if you did not receive the email. Now we're going to transition over, and I'm going to do a quick demo for you of those tools. Actually, I think I'm going to try to see if Brad has his audio, if he would like to walk through. I'm not hearing from Brad. Okay, no problem. So this is the fraud risk assessment tool. Again, this is the first step in this larger fraud toolkit. The toolkit will eventually include specific sections related to prevention, which we have that today, detection, enforcement, and recovery. So we do plan to dig in much deeper into many aspects of fraud. So this, again, is the fraud risk assessment tool. You can see we have multiple categories to focus in on: systems and software, staff training, provider training, management and communication, selections, and procedures for suspected fraud. So essentially, the tool is pretty easy to use, as whether you're, an eligibility worker just trying to learn a little bit more about your program, maybe you're a manager and you really, think maybe some changes are needed, you're a fraud investigator, this really can be used by anyone within the program to learn more and build on it. So you just simply sit down and go through the questions. We'll go ahead and just walk through a couple on this tool. Does your agency have security roles in place to limit data access to only those who need it? And then your answers are either yes, no, or I don't know. Depending on your response, a risk level will automatically populate. So in this instance, I said yes, we have security roles in place. So the risk is low, and then it provides a recommendation. If I would say, no, we don't have these security roles in place, then the risk level is going to be medium. And again, we provide some recommendation there, some steps you may want to take to improve that risk level. So if I just go down, answer a couple more of these, just again, I know I'm going through this quickly, but knowing you also have this handout, get some responses here. And then assuming that I would go down and answer all of these, you can then switch over to the results summary tab. And I didn't answer all of them, of course, but it'll give me a count based on what I did respond to. So 3 of my responses had a low risk, 1 of those had medium, and 1 had a high. Then we also provide this overall risk count by risk level. And this box here is really a duplication of the graph, just showing it in a different way. And then also a risk score or risk rating. But then what I really like about this tool is we break it down by category also. So again, I only responded to system software, but right here it shows me how I responded. So I had 1 high risk, 1 medium, and 3 low. And of course, it shows you your risk summary based on all the categories. So maybe there's one category that you need to focus in on a little bit more within your program. Or maybe you have a lot of I don't know responses or not assigned. Maybe that just means you need to ask some more questions and get to know your program, your processes a little bit better. So again, just a quick demo of the fraud risk tool. I have a question here. I'm just seeing, can I make it bigger? Yes, I think I can. I would need to, actually, I'm going to switch over to the other one first. So now, hopefully, you can all see the prevention tool. And I will make it larger. Let's see, I'm currently at 80%, so I'll make it 90 and see if that might help a little bit. So now we have the fraud prevention risk assessment tool, and this is digging into specifically prevention. And again, we're going to have these tools for each section that I talked about. So prevention is specifically digging down into program administration. And actually, if I click on here, click on the drop down, we have case management training and support, information technology related, program administration, and verification. So you can see a lot of these are kind of tied primarily to the program office, but I did want to just mention that the detection tool, which is coming out very shortly, hopefully within the next few weeks, that focuses a lot more on the provider side, invoicing, billing records, just taking a closer look, again, kind of at the provider side, where this one's kind of more in-house client eligibility side. But again, if I would go through here, you know, depending on my role, I might know some answers, I may not, but hey, you do your best, you go in here, you respond to the questions. If you answer yes, you know that the CCDF program clearly defines its verification policies and procedures. And anytime we thought, you know, we needed a little additional explanation, we tried to throw in an example. So everyone knew, you know, what we were trying to get at when we posed these questions. And again, you answer yes, no, or I don't know. And then based on your answer, a risk level is pre-populated or automatically populated. And then we provide a recommendation. Of course, since this one's a low risk, we kind of reiterate that having clearly defined verification policies can help case managers in determining if the documentation obtained or provided meets protocols and standards. But if you happen to say no, you don't have clearly defined verification policies and procedures, then the risk becomes high. And we provide some strategies and recommendations around, you know, why. For one, why might that be high risk? And two, you know, what are some things that you could consider to get that risk down to low? So same thing as the other tool, you go down through, you respond to the questions, you know, a recommendation populates for you. I'm going to just go down. And again, I know you all have this, so you can feel free to play around on your own. And certainly we would love to get your feedback. Maybe, are we missing something? Is there something we didn't think of? We'd love to get that feedback from you. If there's ways that we can improve this tool, add a category, we're happy to do that. We just need that feedback. So it looks like I'm saying yes to a lot of these. I guess my program knows what they're doing here. So same thing. I'm just going to do one section just in the interest of time. Go over to the results summary. Hopefully you can see this okay. I don't need to expand the view on this one. But again, I didn't answer all the questions, but it does show the risk assessment summary for the questions that I did answer. Now, it looks like my program's doing pretty good. Our most common response was low, here with 8. Then again, this box here reflects kind of the same information that's over on the bar graph on the left, just shows it in a different way. But then all the way over on the right is the category-based risk summary. So again, based on those specific categories, how's your program looking? Do you have any areas that are high risk that maybe you need to take a closer look at? You know, what are you doing well? What do you have low risk? You know, what areas? So lots of different ways to look at this tool. We hope that you all find it useful. And again, we would love to get your feedback. I'll pause just for a minute, make sure I presented kind of what Brad may have wanted to present himself. Is there anything that I'm missing, Brad, or that you'd like me to show more? Does anyone on the phone have any questions? I don't see any hands raised, and I don't see any questions. So I think we'll just go ahead and keep on moving along. Pause just for a second while I'm switching screens here. I think in the interest of time, I'm going to keep us moving along. But again, if you're, playing around with that tool, you have questions, if you have feedback for us, please don't hesitate to send that our way. We'd love to get your feedback, especially if there's ways that we can improve that tool for your use. All right, so now we're going to get into specific fraud prevention techniques. And again, as time permits, we hope to open it up for conversation, but we'll probably wait until the end after Delaware and Georgia have their turn to present. But again, if things pop up in your head, please go ahead and type them into the question box, and we'll get to those at appropriate times throughout the conversation or throughout the presentation. So when we think of fraud prevention, we're thinking of ways to prevent and deter fraudulent activity both internally, so within our eligibility, provider, and payment systems, as well as externally, so with other federal programs, maybe through database linkages, linking up with the community or stakeholders. There's really a large variety of techniques that can be used under each of these fraud sections in our webinar, but what we are sharing today is certainly not going to be all inclusive, but they are techniques that we hope get you thinking about your program operations and accountability measures, but also specific to your particular role, whether you're eligibility worker, supervisor, program manager, or fraud investigator. So this particular slide focuses on data. If you were on our December webinar just a few months ago, we discussed all of these strategies in pretty significant detail and included a variety of options, challenges, as well as benefits. Since we did have that detailed discussion on the last webinar, I'm not going to dig into each of these today, but we did include the link there at the bottom of the screen for anyone that missed it. You can view the slides and the recording, and that link, fingers crossed, should work in your handout as well. As a refresher, data sharing incorporates the sending and receiving of case information, but we do want to note that this can be an effective tool to prevent fraud, waste, and abuse. Data mining, like data analytics, is a multi-function tool. So for purposes of prevention, data mining can provide system reports that identify those red flags. And we heard Ellen talk about red flags. We talk about red flags a lot when it comes to fraud prevention and detection. But we also don't want to forget about system alerts or alerts that are generated to eligibility workers or maybe supervisors during the case processing. And those alerts are going to be generated as a result of action taken or maybe data entered into a case. Data analytics or data analysis. This is another area that we really wanted to reiterate as a valuable tool when it comes to fraud prevention and ensuring program integrity. But we also wanted to point out that data analysis does not necessarily require high-tech software or some highly sophisticated program. A more simple example could be staff manually inputting information into Excel, maybe on a monthly or quarterly basis, and then using that imported data, an analysis can be performed using Excel. And with that analysis, you're identifying the risk areas. So from there, the lead agency can review policies and procedures, protocols, find ways to close the gap in a more proactive measure moving forward. So in other words, prevent and deter those potentially fraudulent activities or program violations from future occurrences. Next up here is unique identifiers. We do certainly recommend unique identifiers be given to individuals within a case as well as the providers. And this can certainly be a useful tool in fraud prevention since it can prevent families and providers from receiving any duplicate benefits. Like many of the processes that we'll talk about or that you're performing in the state every day, it's especially important for intake workers to adhere to the processes that your agency has in place to avoid any duplications. An example here may be to complete a name and address search prior to entering a new case into the system. And then a check and balance for this would be a system alert that would alert the worker to duplication of an individual. And that alert would stop an application from further processing without someone taking a closer look. Since we are talking about adherence to processes, I did want to just let everybody know that many audit findings are due to the state not following their own processes. So, quick note, any policies or procedures that are put into place by the agency should be tied to some level of oversight and internal controls. Front-end detection for eligibility staff. This is one where I would love to have an entire webinar on it. So if you feel the same, let us know in your evaluation. But another good prevention technique, based on the types of fraud or potential fraud seen within your program, have the eligibility staff complete a basic fraud training, maybe just annually. The trainer might be a staff member from the investigation unit or an eligibility supervisor, or just someone else within the program. During the training, whether web-based or in person, communicate those problem areas or risk areas. Based on past cases, those risk areas are what you see in your program. Utilize eligibility staff as part of your front-end detection system. Another important thing here with front-end detection that I didn't want to forget about was recognizing altered documentation. And then also providing protocols for what workers are supposed to do when they see something questionable from an applicant. One of the examples that I think about with this one is pay stub and looking at the year-to-date column. That should just, happen naturally. Always look at the year-to-date. Many times, that intake worker or eligibility worker is looking at a series of pay stubs, probably 2 to 4. Does the year-to-date match the gross income that's reflected on the pay stub? Just a quick, easy check that can be done when you're looking at pay stubs. A verification desk guide. So this can really help with maintaining consistency across eligibility determinations, but also just having a simple, one-page desk guide. It can help ensure eligibility workers are all reviewing acceptable documentation per your child care policy. And saving some of the most important fraud prevention strategies for last are communication and the fraud hotline. So advertising a fraud hotline, getting it out there, making it easy for folks to report potential fraud, as well as communicating the consequences, is a great way to deter fraud from even occurring. Janae is going to talk a lot more about reporting fraud in just a few more slides, but I just wanted to take an opportunity to mention that many of these prevention techniques are also some of the same techniques that can be used to detect fraud. And I think, again, I'm looking at the time. I'm going to go ahead and skip through this one, but please note that all of the slides are in the handout. So some of these kind of transition slides have data related to what the lead agencies are reporting as their fraud prevention and detection techniques. But again, you have all these slides in your handout. You have the data. The information was pulled from the most recently submitted CCDF plans, 2019-2021. So now I'm going to switch over to detection strategies. The first one here is case analysis or case reviews. These can be used as a prevention or a detection technique. So through case review or analysis, supervisors or quality control staff can catch those decisions that weren't made according to policy. Or maybe in reviewing case documents, they may see items that are questionable or potentially fraudulent. These case reviews ensure the staff are correctly applying policy and following procedures during application determinations or redeterminations. Some of the supervisor reviews may include red flag reports. When using these types of risk reports, many times the system is automatically catching those items determined by your program office to be potential fraud, program violations, or administrative errors. Red flag reports can also be used to prioritize investigations, and we're going to hear more about that from Georgia during their presentation this afternoon. Attendance monitoring and reviewing of provider invoices. This is another pretty easily employed detection technique. Having staff review the invoices and attendance records or setting up those red flag reports. We have some examples here, but I'm not going to go into detail with these because I know that Ben and Ryan, Georgia's presenters, they're going to talk specifically about these types of detection strategies when they walk through their risk assessment tool. Another detection technique is internal auditing. So auditing of billing methods and processes prior to payment going out the door. And this can be implemented by trained staff who really have a strong knowledge of both payment practices, eligibility, as well as just kind of overall processes. So again, kind of thinking about your agency's past experiences when performing a random audit of provider billing, what sort of things should reviewers be looking for? And always kind of have that, in their minds. What are they really looking for based on your past experience? Provider site visits, that's another good one. Either a random percentage based on the number of providers, or maybe your site visits are based on provider errors or program violations. But these visits can be done by your program office or maybe even through collaboration with another program. We hear a lot about collaborating with the Child and Adult Care Food Program, or maybe it's even the licensing division if that happens to fall in another department. But for example, if there's some documentation issues when the food nutrition visit occurs, then maybe licensing or the child care program office should follow up and maybe have their own unannounced visit. There might be some child care documentation issues as well. The next bullet here is verifying the applicant's identity. This one might kind of seem obvious, but verifying the identity of the individual by requesting state ID, driver's license, school ID, it may help to avoid confusion down the road or even detect potential fraud down the road a little bit. Finally, on this slide, the fraud hotline. So though a fraud hotline is not specifically required by CCDF, it is definitely a great tool and communication technique for outside sources for them to utilize and have a method to report those potentially fraudulent activities. And we do know that a high percentage of states have the fraud hotline, so kudos to all of you. And once again, I apologize, we're going to have to skip through this one, but you have the handout with the data included. Again, just want to make sure we have time at the end for those more deeper discussions with Georgia and Delaware. So now I'm going to turn it over to Janae, who will talk through reporting fraud.
Awesome. Thanks, Leanne. So as Leanne discussed, the fraud hotline can assist a lead agency with the prevention and detection. But what we'll look at now are some of the communication pieces related to fraud reporting. So with understanding that, having the ability to communicate with stakeholders, the community, or whistleblowers is an excellent way to receive potential fraud referrals. Individuals outside the lead agency could ultimately be a set of eyes and ears for the lead agency. Now, on your screen, there are a few ways a lead agency can open those lines of communication. The communication outlets can be a fraud hotline, a web submission form, fax, email, etc. Having those open lines of communication that are easily accessible can prove to be a useful tool for the lead agency in their detection, prevention, and enforcement efforts. Now, when developing those lines of communication, another important factor is the lead agency having protocols in place on how they handle the referrals, and that's all referrals, including those who want to remain anonymous. Not all individuals want to be identified. They may only want to provide the agency with the information to investigate and not be contacted in the future. So it's important that the lead agency has the ability to acquire the information, investigate, and protect the identity of the referee. Next on our list here is coordinate. So coordinating with other agencies is another way to receive referrals. If an individual, and I think Leanne advised us this earlier, have violated in one program, this may pose as a red flag indicator for the CCDF lead agency and could be considered an automatic referral for investigation. And lastly on our list here is public motivation. Now, this can be done through pamphlets, handouts, websites, newsletters, town halls, etc. Helping the public to understand the CCDF benefit need within the community, and for those with a wait list, stressing that, this may motivate the public to send referrals on those suspected of claiming ineligible benefits. These are just a few examples related to reporting and communication to consider when developing or reviewing your referral strategy. Next slide. Yeah. All right. So what we'll talk about now is investigation techniques. Fraud investigation techniques and strategies will vary across lead agencies. And for example, the lead agency may coordinate with another agency or organization, or have their own dedicated unit, or utilize their eligibility staff for investigation. Each of these processing methods will directly affect the lead agency's investigation procedures or techniques. Now, our two state presenters, Delaware and Georgia, will share two different methods related to their fraud investigation structure. Well, what we'll go over is a few basic techniques here. So one of the techniques that we have, and it's directly involving the program office or management, and that's ensuring that all CCDF referrals, fraud referrals, are tracked. This technique, when applied, encompasses the tracking of referrals from start to finish, including the referral outcome. Next on our list is investigators being trained, and that's trained on all eligibility, verification, payment, and investigating procedures and policies of the lead agency. The only way an investigator can advise of a program violation or fraud is if they know the program. And next we have here defining intentional and unintentional program violations. So it's important that the agency's investigators know the difference between the two, and conducting administrative reviews. In cases, this is a great technique, especially for cases that will go to adjudication or prosecution to an administrative law court or the internal attorney general's office. The two basic reasons for an administrative review internally is one, is to provide an opportunity to the participant or provider to defend their actions with the lead agency. This will allow the lead agency to mitigate any types of discrepancies within the case without the use of additional resources. And next here we have monitoring. So Leanne did talk about monitoring and analysis, so I won't go over that additionally here, but it is important that the program office and management reviews risk assessments either monthly, quarterly, or annually. And next slide, we're getting there. Okay, so, and we'll talk about our investigators now. So having a solid investigation procedure can assist the lead agency in ensuring actions are taken appropriately by the investigator. On the screen, we'll see a list of some basic investigation techniques that may be incorporated in the investigation protocol. First, we have the referral review. This is simply reviewing the referral against the lead agency's procedures and policies. We know from our experience that not all referrals are valid referrals to claim a program violation or fraud against someone. Next is research. Utilizing all available resources can maximize the extent in which an investigation can be conducted, which brings us to evidence. It's important that there is substantial evidence to support the claim, and when gathering the evidence, this usually brings the investigator back to the referral and the need to use critical thinking skills. So answering the various questions, is there anything that would counter the evidence? Are there any additional questions or missing elements? Something as easy as answering the 5 W's of who, what, when, and where can assist an investigator in their critical thinking. And next, we have our interviewing technique. And this should be discussed and outlined for investigators. This can be done through an interview training session that includes what should be asked, what shouldn't be asked, what is active listening, if and when an interview should be recorded, procedures recording as accordingly with law, the state law, and including mock interviews as part of the training session. These all would be great interview techniques and training sessions that would be beneficial to the investigator. And next on our list here is remaining unbiased. It's important that staff approach each case unbiased, meaning that they do not have a preconceived notion and will investigate the claim with integrity and equality. Preconceived notions can blind an investigator to the facts. And Leanne discussed earlier site visits during detection, and this is also a good investigation technique. Evaluating findings, considering all aspects of evidence collected. The purpose there is to remove any reasonable doubt from the lead agency's case determination. And we also have here the fraud and program violation. In an investigator determination for management review, does the synopsis report incorporate all information needed for management decisions? And is it provided to management timely? Next, we have collaboration. Collaboration with another agency may be necessary. An example of this is utilizing the AG's office or law enforcement in cases where the level of improper payments is so enormous or immense, thousands of dollars, like Ms. Ellen Wheatley stated earlier. This would also be a good use of state available resources. And lastly, fraud is determined by the court or voluntary disclosure. So acknowledging that fraud can be considered a criminal offense and the lead agency may be required to appear in court proceedings, investigators should be consistent in investigations and exercising always equality and integrity in their cases. Next.
And, thank you, Janae. Yeah, I think, again, for the interest in time, we're running just about 5 minutes behind schedule, but I think I would like to go ahead and turn it over to our state presenters. But again, I do think there'll be time at the end of their presentations for some open discussion and sharing of strategies with all of you on the phone. So I'm going to go ahead and introduce our 2 colleagues from Delaware. We have Gwen Griffiths with us. She is a certified welfare fraud investigator and director of audit and recovery management services. And we also have Jacqueline Bensel. She is a social services administrator with the program and policy development unit specializing in childcare. So I'm going to go ahead and give control to Gwen. Gwen, you should have control now.
I'm waiting.
There is a bit of a lag today. Okay, it looks like you have it now.
Okay. All right. Thank you for having me here this afternoon. I do have with me as well Crystal Baynard. She is the Deputy Director for Audit and Recovery Management Services. We are the Welfare Fraud Unit for the state of Delaware. Sorry, I'm trying to forward the slide, and it doesn't seem to be going with the arrow. It doesn't look like I have control of this.
Okay. Apologies, everyone. You want to go ahead and try again, please?
No, the screen doesn't look the same like it did when we did the run through. So you can just forward my slides. We are responsible for the audit and investigation of acts of fraud or error in public assistance programs administered by the Delaware Department of Health and Social Services. ARMS falls under the Division of Management Services, which is one of the 11 divisions within the department. The Division of Social Services is responsible for determining eligibility for the department's public assistance programs, for which ARMS is responsible for fraud investigation. There are other assistance programs not in our purview, such as WIC, which is administered by the Division of Public Health in Delaware, and LIHEAP, which falls under the Division of State Service Centers. ARMS has responsibility for the accounting and collection of all public assistance debts owed to the department, and utilizes every method to recover those funds, including wage garnishments, state and federal tax intercepts, lottery intercepts, benefit recoupment, court-ordered restitution, estate recovery, etc. Next slide. The public assistance programs that ARMS investigates or audits include SNAP, TANF, General Assistance, which is a state-funded program, Purchase of Care, Emergency Assistance, also called Diversion Assistance, Refugee Cash Assistance, and Medicaid. In Delaware, the Attorney General's Office has a Medicaid Fraud Control Unit that investigates Medicaid provider fraud and prescription drug fraud cases. ARMS only investigates Medicaid eligibility fraud. Within the Division of Medicaid and Medical Assistance is a Surveillance and Utilization Review Unit, also known as our SUR unit. This group investigates cases in which an individual is pill shopping or utilizing their benefits in a wasteful manner, such as repeatedly going to the ER for non-emergency visits, etc. The SUR unit works more closely with the Medicaid Fraud Control Unit than our unit does. Next. The functions within our unit are operations, which is also referred to as our investigative operations unit, which is responsible for all investigative functions from initial referral intake to case resolution through administrative or criminal procedures, establishing overpayment claims for fraudulently obtained or misused benefits. ARMS currently employs 30 full-time employees and 8 casual seasonal positions statewide. And if you know Delaware, we're pretty small. It's about 100 and some miles top to bottom and 45 miles across. ARMS currently has 25 of our positions dedicated to investigative operations. Accounting processes payments of over $3 million per year, including more than $1 million from tax and lottery intercepts. Our Collection Enforcement Office manages over $9 million of delinquent claims and processes hundreds of civil judgments through Delaware's Justice of the Peace Court for claims under $15,000 or Court of Common Pleas for claims in excess of $15,000. We currently have about $17 million in outstanding accounts receivable. Administration is responsible for the overall business functions, including staff development and oversight, policy development, grant management, budget control, etc. Next, please. As you may know, states participating in the Paris Match send public assistance eligibility records to the United States Department of Health and Human Services Administration for Children and Families. Records are matched based on Social Security number to identify if individuals are collecting benefits in multiple states concurrently or if they are receiving federal retirement or military income. The Veterans Match checks for VA medical benefit eligibility. ARMS also performs a quarterly Delaware Department of Labor wage match, which is considered part of the income and eligibility verification system. This match compares actual wage information to the wages reported to the Division of Social Services, and hits are recorded when employment and wages are not reported or when wages are underreported. ARMS receives about 6,000 to 7,500 DOL wage match hits every quarter that require additional investigation. And just in case you're wondering how we keep up with that number, we don't. We currently have a backlog of outstanding DOL cases numbering about 125,000. We also do incarceration match, which is strictly for prisons within the state of Delaware only, and we get a few hundred of those matches a month. ARMS also looks at EBT transactions that are sustained out of state for a period of more than 6 months. Even though EBT, SNAP EBT, can technically be spent in any state at any time, we consider that if someone has not had a swipe in Delaware for more than 6 months, the case needs to be investigated for residency. Last is the multiple card replacement match, which is also a SNAP card match. This is a USDA FNS federal mandate that says whenever a client has requested more than 4 replacement cards within a 12-month period, they need to be notified, and ARMS requests an interview with the client. In most cases, clear trafficking trends are identified with the clients who continually request card replacements. Next. So we receive fraud complaints through different referral sources. One is through the Division of Social Services. They'll provide ARMS with a front-end investigation referral when they suspect that a client is not being truthful or forthcoming with information at the time of application or renewal. We have a Crime Stoppers line, which is part of the National Crime Stoppers complaint lines. We recently had a statewide SNAP Integrity Education Outreach Media campaign funded from a USDA FNS grant, in which we used Crime Stoppers Complaint 800 number and their web address to solicit referrals from the general public. This increased our Crime Stoppers referrals significantly. Outside complaints come from us through the department, legislative offices, other state entities, and directly into ARMS through our call center. We have dedicated fraud complaint phone numbers for each of our 3 counties in the state. We also get QC referrals when their findings require a fraud investigation or audit for possible overpayments. Some people go directly to the USDA, either their phone number or their fraud complaint email, to file a complaint about SNAP fraud. We also get complaints from the OIG, from RSS feeds, and social media. We look at social media through RSS feeds to see if any of the trigger words, food benefit, food snaps, or anything comes up. And then investigate them as well. If ARMS receives a SNAP fraud complaint, which most of what we do is sort of surrounding SNAP, we do look to see if the client is open in other benefit programs, and our investigation includes looking at the eligibility and fraud potential in those programs as well. So that's how we get most of our child care cases, is because they're tied into a complaint that is from another program. Next. This is just a slide about the referral process. The social service case managers, when they suspect a fraud, will send us this form, a referral for investigation or a front-end investigation form, to let us know that they think that something is wrong or that they suspect that an overpayment exists. And now, if she's ready, I'm going to hand the next 2 slides off to Crystal.
Hi there. Like Gwen mentioned, majority of our purchase of care, our child care cases come through with other types of information. We get a lot of complaints that start off regarding SNAP, the food benefit program, but we look at all programs, and many times persons are also opened in child care. So when we get a complaint, we have investigative supervisors who look at the complaint to ensure that there's merit for the investigation. This is just a quick look-see. They're not doing a thorough investigation at this time. Just a lot of times when we get the information, we look at the public assistance case and find that the allegations are unfounded. If we find that there is merit to the tip, we then assign it to an investigator who conducts a thorough investigation. We gather both electronic evidence and direct evidence from multiple sources. So electronic evidence is database information, typically LexisNexis and many other databases, criminal databases. We then can also do field work, which is going to be collateral contacts. We can speak to neighbors, relatives, daycare providers. That all of this information is gathered that is going to either prove or disprove the allegation. If we find that there is an overpayment, they're going to create an overpayment for claims processing. Not all of our overpayments are fraud, but if fraud has been determined, the investigator is going to complete the process depending on the type of program. So the majority of our cases are SNAP cases, and then we'll also have child care attached to it. So for the SNAP process, we do have an administrative disqualification process. We've got felony prosecution process. And for child care cases, we can pursue a felony prosecution if the burden of proof meets Delaware's code, and we get that guidance direct from the Department of Justice in the state of Delaware. For the penalties for fraud in Delaware, based on Delaware code, ARMS is allowed to pursue benefits that are receive the result of fraud through the Department of Justice. It's considered a Class G felony most of the time, and again, Department of Justice is the one who sets that burden of proof, reviews our cases, and says, yes, this will meet the burden of proof to proceed with a felony prosecution. If we prove that fraud exists, but it doesn't meet the Department of Justice burden of proof, we then look at those other administrative disqualification routes, and in Delaware, that is usually for the SNAP Food Benefit Program and the TANF Cash Program, when we have clear and convincing evidence that the client has committed an intentional program violation. So regardless of which route we go, particularly for the SNAP and the TANF programs, we are also typically seeking a one-year disqualification from the program. We don't have client cases that go that route for child care. If it's not a felony case, then there usually isn't a penalty other than the fact that they will be required to pay every dime of that money back to the state of Delaware. And again, a lot of times the high dollar child care overpayments are attached to SNAP food benefit overpayments as well.
Okay, thank you, Crystal. And you can go on to the next slide. Good. So the breakdown of work related to these programs, to the programs that we investigate in, 86% of the work of our unit is dedicated to SNAP fraud investigations, SNAP collections, and SNAP disqualifications. We do, again, do the POC child care programs, but as you can see in the percentages, it's much less. And then the other programs are even lower beyond that. You can go to the next slide. And then our revenue collections sort of mimics the same idea, that most of our revenue from collections is from the SNAP program. POC is creeping up significantly. We've seen higher dollar overpayments in the child care program, depending on when the individual is brought to our attention, because there are a lot of dollars that are paid out for the child care program. So we are seeing the accounts receivable in that grow, and the overpayment amounts generally grow in those programs. Next. This is just to show the number of claims that we established for each state fiscal year leading up to last state fiscal year, where we had only 176 actual claims for the child care program. Next. And that was it. And I didn't know if you wanted to go on, Leanne, and we'll do questions at the end, whatever you want to do.
Thank you so much, both Gwen and Crystal. I wanted to give Jackie Bensel an opportunity to see if there's anything she would like to share from Delaware's Department of Social Services, like kind of more from the program office perspective, and making that referral to ARMS, the procedures or, processes on your end, Jackie, and then whenever you receive that referral back from the ARMS unit, what procedures may you be following, or your supervisors, your team be following within the child care world for purchase of care?
Well, in the subsidy unit, what we have there is we have our child care monitors who actually will go out into the field to their providers. So where ARMS concentrates a lot on the client end of it and the eligibility issues, and I think we're going to see more being more involved with providers. Internally, out of the subsidy unit right now, we have our child care monitors that will audit that. So before they go out to a visit, they will print out their attendance sheets. They'll go out to the provider setting. They'll compare those sheets to see if there's any discrepancies. And backing up a lot of what you've already covered, the holidays might be recorded when they shouldn't. If they find discrepancies in their attendance compared to what they have entered to be paid, they will have the provider readjust that. So our system automatically sets up a recoupment process. So if a provider has entered attendance that did not support what they actually had, a child had been there, was a school-age child, they claimed full-time when we know that they were there part-time, and they make that adjustment, then when they enter that adjustment, our system will recalculate what we've already paid out and what they should have been paid. And then they will start a recoupment process. So that's how right now, how we are set up to kind of capture providers and if there's any fraud detection on when they submit their claims. And another thing that we also do is we work with our tax intercepts. We make sure that their EIN numbers are matching what they file under their taxes. We have had the IRS come send us levies, so we would have to enter that as another recoupment process. And another thing that our monitors will do is if they give the providers 10 days to make these adjustments. If the providers do not make that adjustment within the 10-day time frame, they will go ahead and adjust their dates in the system. So that way they cannot bill until they've made those adjustments, and they will quickly make those adjustments. So that's basically what we do in our part out of the subsidy piece of it, if that helps any.
Sure. Thank you for that. So I guess my next question would just be, so maybe this one's more for Crystal and Gwen, but that I believe it was 7% of investigations that ARMS performs is related to purchase of care. Those referrals, where are you getting that 7% from? When you're investigating potential child care fraud, where are those referrals coming from?
So they could be from any of the sources. They could be, attached to a case that was a SNAP fraud case, or they could just be an outside complaint, or possibly from the child care staff here might have some question about an individual. We do get provider referrals as well, and we have had some cases that have gone all the way to, the process of somebody appealed their overpayment for a child care overpayment. But we get them from, like I said, any source. It can be attached to another program or just an individual outside complaint about a child care case. Now, when we go through the process and we do the investigation, we create an overpayment, and the case is completed, we do send that information back to DSS, Division of Social Services, for them to act upon it. So it's up to them at that point to decide whether or not if it's a provider case, whether or not the Office of Child Care Licensing needs to be involved. If we, because we don't have a sanction process in Delaware, we kind of consider all of them to be like an IHE, inadvertent household error kind of case, or if it's going to be prosecuted, it's one thing, but we don't make that determination of what happens to the provider or what happens to the individual. We don't have an individual sanction process for child care in Delaware, so basically it's up to DSS to determine through their policies what needs to be done with that client or provider.
Sure. Great. That was a lot of fabulous information. And I think it's important to kind of let everybody know that this is just one example out in the states of how a fraud investigative unit might look. So, of course, in Delaware, we heard that their unit investigates multiple areas of fraud, including SNAP. That's the big ticket one with 86%. Childcare is just a small piece of that, as well as TANF and medical assistance. So that's probably familiar to a lot of you on the call. That may be similar to what your state or how your state is set up when it comes to fraud investigation. Does anyone have any questions for Gwen and Crystal or Jackie before we move forward to hear how Georgia has their fraud investigative unit set up? Desiree in Colorado, I see you have your hand raised. Did you have a question? I will unmute you quickly. Desiree, you are unmuted if you have a question. Okay, I'm going to go ahead and mute Desiree again. All right, so I don't hear any or see any other hands raised. Oh, Sandra Johnson from Louisiana. Oh, Sandra, it doesn't look like you have your PIN entered. So unfortunately, I can't unmute you on my end unless you have entered your PIN. So Sandra Johnson, you can go ahead and enter your question in. Stacy Shell has a question for Jackie. How many pay periods do your child care monitors review for providers?
The pay period?
Yes. So the provider, well, first of all, how often do you pay providers? Weekly, monthly?
Okay, so we pay the providers every month. They enter their attendance the following, usually by the 5th of the beginning of the next month. So what the monitors will do is they usually collect anywhere, I think mostly around 6 months worth when they print out the attendance sheets. And they'll go out and they'll compare. We've even done as much as a year's worth, depending on if this is a person that we've had history with and finding discrepancies. Or if they've got a history of recruitments, then we will pull out more records. And we also sometimes we'll compare that with the food program as well, the attendance sheets. We have found discrepancies between their attendance sheets with us compared to the food program, and we'll detect that as well. So, yeah, it can be anywhere from 6 months to almost a year's worth of attendance sheets that they will pull. And when we have our big centers, we usually take all of our monitors out there because it can be an all-day visit. Does that help?
Yes. Stacy says great. So we're going to go ahead and keep moving. Thank you again to Gwen, Crystal, and Jacqueline. Hopefully we'll have time at the end to respond to more questions and get more discussion. But we're going to move to Georgia's presentation. Again, a lot of folks might be familiar with Delaware's setup, where their fraud investigators are looking at multiple federal programs, SNAP, purchase of care, TANF. But now we're going to move to a little bit of a different setup with Georgia, right from the start, Department of Early Care and Learning. Their investigative unit is set up a little bit differently. But again, some of you may find this, you may be familiar with this setup as well. So one of the points we're trying to make today is that fraud units can be different, but that's okay. So without further ado, I'm very pleased to welcome Ryan Ringsrud, Deputy Commissioner for Finance and Administration, as well as Ben Appling, Director of the Audits and Compliance Unit. So Ben, I have given you controls. Hopefully that works for you, and you should be able to go ahead and, get started.
All right. This is Ryan. Thank you for that great introduction, Leanne. And good afternoon, everyone. I'm excited to be with you guys to discuss Georgia's program integrity activities related to CCDF. We're going to start out by telling you a little bit about DECAL, Georgia's lead CCDF agency, and some stats from our CCDF subsidy program. Then I'll go over some of the stats from our program integrity activities and discuss our review processes, including our risk assessment. After that, Ben is going to talk with you guys about how we've automated some of these processes and how that has impacted our program integrity activities. All right, so first off, who is DECAL? DECAL is Georgia's early education agency responsible for administering birth to 5 early education services throughout the state. We're one of only 3 states that I'm aware of in the country with an agency solely dedicated to birth to 5 early learning. I believe the other 2 are Massachusetts and Washington. The programs we administer include Georgia's CCDF subsidy program, as well as Georgia's pre-K program, which is a universal lottery-funded pre-K program that serves about 85,000 4-year-olds and gets them ready for kindergarten. We also administer both USDA food programs in the state of Georgia. We're responsible for licensing and monitoring child care centers, so we have licensing division in-house. And we are also responsible for Georgia's QRIS, or Quality Rating Improvement System. One of the advantages we found to having all these services under a single state agency and under one roof is that we have access to lots of different pieces of data that we can use to inform our program integrity activities. We have data from all of these various programs I just mentioned. We also have access to people who are largely program experts within each program who can inform our thought process regarding our program integrity activities. All right, so a little bit about Georgia's subsidy program. In Georgia, we call our subsidy program CAPS, which stands for Child Care and Parent Services. So throughout these slides, you may hear Ben or myself refer to the CAPS program, and that's just what we call our subsidy program. We also thought it would be important to give you guys some kind of stats on the size of the program so that you can have some context to some of the stuff you're going to see later in the presentation. Our CCDF funding totals just over $300 million, and we serve approximately 50,000 children, and there's about 3,500 providers participating in our subsidy program. Okay, at DECAL, our Audits and Compliance Division leads all program integrity activities and initiatives. The division is fairly new. It was created in 2013. Program integrity activities were conducted prior to that, but those efforts were largely based within each program area. By consolidating the agency's program integrity activities under one group, we were able to kind of, streamline and enhance our approach by having a unit solely focused on program integrity and with an expertise in program integrity. Also, by working to adopt a more comprehensive view of our clients and providers and incorporating their data, it allowed us to be able to take like a more global view of what was going on across our agency. One example of that might be if we have a provider, all of our providers are largely participating in our universal pre-K program. They're also probably participating in our food programs, and they're also participating in our subsidy programs. So a good example would be if we have a provider who's having problems in pre-K, say they're having trouble administering the pre-K grant, they're not using their funds correctly, well, there's a really good chance they're having problems in CAPS, our subsidy program as well. It just may not have bubbled up at the surface yet. And now that we have one unit looking at all that, we're able to tell the program side, hey, you guys may want to target some technical assistance towards this provider because they're having some issues on pre-K, and maybe in CAPS you could get out in front of it. Within the Audits and Compliance Division, we have 3 units. The first is a group of financial auditors who largely do pre-K audits. The second is a group of nutrition compliance examiners who do compliance review for our 2 USDA food programs. And the third is a group of investigators who are focused on our subsidy program, CAPS. This group currently includes a manager, 2 supervisors, and 8 investigators, so a total of 11 staff. These investigators are based in the field throughout the state. This is important because they do site visits as part of every investigation and need to be close to the child care centers they're investigating. Just some quick stats or results from last year. We completed approximately 235 investigations of both parents and providers, and identified approximately $3.2 million in improper payments. And again, that's out of the $300 million I mentioned earlier, so a relatively small percentage, which we take as a good sign that most providers and parents in Georgia are doing the right thing. All right, now I want to talk a little bit about what our reviews look like. We have 2 types of reviews that we do on our subsidy program. The first is focused on providers. And generally, those reviews are focused on ensuring that the invoice they submit for payment matches the attendance. In Georgia, we require sign-in, sign-out sheets be kept by providers to verify attendance. So when we do a review of a provider, largely what we're looking at is, does the documented attendance via sign-in, sign-out sheets match what they billed us for? And so if there's any difference there, meaning they billed us for more than the sign-in, sign-out sheet support, that's generally going to be an improper payment, which would be required to be returned to our agency. For parental authorities, our reviews are generally focused on ensuring the eligibility was determined correctly and that it was determined based on current, correct, and complete information. A couple examples of this might be income. We have sometimes where maybe the case had provided income that wasn't accurate. Maybe they left out the income from their second job. We also sometimes have issue with the approved activity, which, most of the time is employment. Sometimes we may have a parent who loses employment and 6, 8, 9 months goes by, but they just choose not to report to us or tell us that they've lost that employment. So our parental authority investigations are focused on the eligibility and was the parent actually eligible. As far as how we get these investigations or get these reviews and initiate them, they can largely be identified in 2 ways. The first is through referrals, and that's just a fancy word for complaints. We receive referrals from our eligibility staff who do eligibility determinations. We receive referrals from providers. We receive referrals from parents, from other state agencies. Sometimes our own investigators who are doing one investigation may see something on another provider or parent and make a referral there. Sometimes we just generally get them from concerned citizens who see something in their community. They really can come from anywhere. In fact, we've even gotten referrals from the FBI in recent years. The other area or way that a review or investigation can be initiated or identified is through our risk assessment. And you've heard a little bit of talk about a risk assessment today, and we're going to discuss throughout the remainder of this presentation what exactly our risk assessment looks like, so I'm going to kind of leave that sitting for now. Lastly, I just wanted to talk to you about the results of our reviews. These reviews generally result in a dollar amount of funds that we paid out improperly. It could be because the provider billed us for a child who was not in attendance, and so we should not have paid for that care, or that the parent wasn't actually eligible for whatever reason, and so the dollar amount that was paid out needs to be recouped. Whenever we have that and we complete a review or an investigation, we notify both the provider and the parent via a letter and tell them the amount that is owed. We also notify our subsidy program staff so that they know what's going on, and if they have any questions, we do our best to answer those. When we notify the provider or the parent, we do provide them appeal rights, and once all appeals are exhausted and it's determined to be a final amount, that the overpayment that is due back to the state, we collect the funds that are owed to us through largely two ways. For providers, we net out or withhold a portion of future payments. So say you owe us $1,000, we may withhold 50% of future payments until you've paid off that $1,000 debt. And for parents, we enter into a repayment agreement, and we try to be really cognizant that, you know, these parents largely don't have a lot of funds, and their ability to repay us, we may have to be a little bit flexible. So we try to offer as flexible terms as we can while still being good stewards of state funds. All right, next slide. Okay, so now I want to talk a little bit about what is the risk assessment we use. I mentioned that on the previous slide. After the Audits and Compliance Division was created in 2013, our subsidy program, CAPS, had just gone through a program audit by our state auditor. One of the findings during that program audit was that our program integrity activities were totally reactive. We were receiving complaints or referrals, but we weren't really doing anything in a proactive way. At the same time, and somewhat separate from that, we recognized that we had a lot of data available to us that wasn't really being used. Just within the CAPS program, we have payment data, we have eligibility data, we have certificate data, provider data, we have data on parents, we have data on children. And then from the other programs we operate, we have a vast amount of licensing data. We have compliance and attendance data from our other programs, such as pre-K or the USDA food programs. And really, none of this data were we really examining it in any kind of way to try to identify red flags or providers who might have some kind of risk. And so we realized when it came to program integrity, we really were data rich, but management information poor. That's a line my boss used to use all the time, and it's kind of funny that now I'm using the same line. So once we came to this realization that we had all this data, but we weren't really using it to inform our selection of audits or our program integrity activities, we decided to identify what data elements did we have that really could be a red flag for program integrity. So let me kind of give you an example. What if we have a provider who bills us for 1 week of child care for 80 children? So that seems pretty normal and a pretty common occurrence. But what if we knew a little bit more? What if, in addition to that, we found out this provider was only licensed to care for 20 kids? Okay, so that looks a little fishy. What if on top of that, we realized that he billed us for 80 children for 90 days straight or 6 months straight? Okay, now that starts to look even a little more fishy. What if on top of that, the same provider in the previous year had been placed on probation by our pre-K program because they had been misusing their pre-K funds? Okay, so now we're starting to have 2 or 3 red flags here all at one provider. What if we found out on top of that, during their last licensing visit, they had received multiple citations? This would be an example of a provider with multiple red flags that likely warranted some type of program integrity review. But under our old process, if it had not bubbled to the surface or there had not been a complaint, we largely would have never really known about any of this. Now, keep in mind, none of these red flags necessarily mean that fraud is occurring, but what they do is they allow us to better target our limited program integrity resources so that when we see these red flags, we can get out there before it gets even worse and more funds go out the door that shouldn't. But this kind of example that I just had and our discussions around it was really the birth of our risk assessment. we identified 10 to 12 risk factors, 3 or 4 of which I just walked through in my little example, and we assigned both points and weight to those risk factors, and we made the points total to 100 because we wanted it to be like easy to read and understandable. So the result was an annual risk assessment of all 3,500 providers who participate in our CAPS program, where we look at each of these 10 to 12 factors and we give every provider a score. The higher your score, the more likely you are to receive a program integrity review. This worked for several years, and we ran the risk assessment manually with humans for several years. It was very successful. It almost doubled our total dollar amount of improper payments that we identified. However, after doing it for a couple of years, we kind of started to see a downside. The process was completely manual. Because it was manual and done by a human, it was prone to error. There were a lot of spreadsheets and Microsoft Excel and formulas and data dumps and things like that involved. And, we're all human. We all make mistakes. It was extremely resource intensive because people were doing all the work. And it was only done once a year. It wasn't in real time. It got so bad that it got to the point where we had to create a new position just to keep us on track with what data is coming in, what data is coming out, what data needs to be coming in, what needs to be analyzed, when does it need to come in. And we kind of realized that it was the manual nature of our risk assessment was becoming a little bit burdensome. So we then kind of began discussions on ways to minimize these downsides and the manual nature of this. During this discussion, we kind of envisioned an automated risk assessment process. And this is kind of when our vision of where we are now really came to fruition. We kind of thought, hey, if we had a system, an electronic automated system to do this on an ongoing basis, and what if it could create a living, breathing risk score for each provider out there? Think about like when you log into your online banking or wherever and you see your credit score. Your credit score is a living, breathing number. It changes. When you conduct a transaction or take out a loan or you pay a bill late, your credit score is going to change, right? So what if we could have a provider or a parent kind of ongoing, living, breathing credit score? And the idea or the vision was that I could come into my office on a Monday morning, make my morning coffee, pull up this system, and see every provider's current credit score, and it immediately tell us where to send our investigators or our auditors. We even jokingly begin referring to this as Ryan's coffee monitoring system. So that's kind of where the vision created, and now Ben is going to talk to you and discuss how we implemented our coffee monitoring system.
Okay, thanks, Ryan. Around the same time as the program began envisioning the coffee monitoring system, DECAL was selected to participate in a statewide assessment on fraud, waste, and abuse, which was intended to determine state agency preparedness to identify fraud, waste, and abuse, including their ability to integrate automation into the process. We were one of 9 agencies that participated in this assessment, and it found a couple of things. While we had made significant strides in our identification of fraud, waste, and abuse over the previous several years, our methods were manual and time-consuming, and that we could benefit from automating our processes. So we decided that we would pursue automation as a goal. Now, there are a couple of ways to achieve this. Number one, we could have built a system ourselves using internal resources, or number two, we could have purchased a product in the market. Because we lack the skills and abilities to build our own system, we decided that purchasing a product would best meet our needs. So we issued a request for information and invited in several potential vendors to learn about their potential solutions. We ultimately selected a company called SAS, which is a data analytics company that was already a contracted vendor with other state agencies here in Georgia, and began implementing the solution. Now implementing an automated risk assessment is no simple task. We spent about a year building our system, which included modules for our CAPS program, as well as our pre-K and nutrition programs. This process included spending weeks talking to our consultants about the characteristics of our programs and how they operate. We spent a lot of time discussing our data environment, including the cadence for which data elements would be sent to the contractor. We also discussed our existing risk factors in detail, as well as discussed new risk factors recommended by our consultants that we previously hadn't thought of. As part of this process, we also found that by automating our risk assessment tool, we would be able to incorporate risk factors that we previously were not able to include simply because our processes were manual. For instance, our child care licensing division conducts more than 13,000 monitoring visits per year. During these visits, they capture certain data elements, such as number of kids in attendance, number of employees, number and types of health and safety violations. This is all data that would be useful to us, but we couldn't capture because our processes were all manual. Having an automated system allows us to capture and use this data specifically for risk assessment purposes. During this time, we went from about 10 or 12 risk factors to around 28 risk factors. Because the number of risk factors has grown so much, we have had to update our scoring system to accommodate. In addition, we were able to introduce dynamic scoring into our scoring system, which allows us to factor recency. For instance, if a risk event occurred less than 60 days ago, we may give that more risk points than if the same event occurred, let's say, more than 9 months ago. We currently have this included in several of our risk factors. Okay, I want to show you a couple of screenshots of our tool. First of all, it is a web-based tool that I can log in and see from my computer, or any computer, including my cell phone. This is useful because if I'm ever sitting in a meeting and someone brings up a provider or asks about a provider or has questions about their compliance history, I can quickly pull up their compliance status right on my phone. What you're seeing now is my landing page, or the screen I see when I first log in. When Ryan talked about the coffee monitoring solution, this is what we envisioned. After I've had my morning coffee and I've read the paper on Monday morning, I can log in and immediately see my most riskiest providers based on our risk model. I can see it in a couple of ways, on a map as well as in a list. From there, I can also see it by month, which allows me to see which providers are the riskiest during the current month, or I can see the risk score measured for the entire year. The same with the list view. Also, I can click on any of the dots or the providers on the list and immediately see the full details of the provider, including all risk factors present for each provider. Now, it's very important to us that this system be a living, breathing system that is constantly being updated depending on the activity occurring at the provider. It's similar to a credit score, as Ryan mentioned, which is constantly changing as the circumstances of someone's financial status changes. Our intention was that the risk results would change based on changes in a provider's history. Now that our automated process is in place, we think we're closer to achieving that goal. In fact, we just recently assigned investigations based off of this data. Okay, what if we want to see which risk factors are really driving the overall results? On this screen, I can see the risk factors ranked by the frequency that the risk factor occurs. It's important to note that our risk factors were developed based on the circumstances unique to our Georgia program and the data that was available to us. Some of these will probably work for other states as well, but others likely will not. If anyone would like to see our full list, please email me and I'll be happy to share them with you. This screenshot allows us to see which factors are driving the overall risk score, which allows us to evaluate the utility of each factor. For instance, for the risk factors occurring the most, we may want to mention these to program personnel to see if there could be any underlying issues that could be addressed through training, depending on which risk factors they are. Likewise, for the risk factors occurring less frequently, we could explore whether or not we wanted to replace those factors with other factors that could be more useful. We can also weigh the factors according to how important we feel that the risk factor is. As a general rule, we strongly value any risk factor that directly results from program noncompliance, even in other programs. For instance, if a USDA nutrition examiner conducts a review of a provider and finds numerous problems, they will likely be rated as seriously deficient in the nutrition program. This is an observed noncompliance and will receive a higher weighting than other factors, which may not tie directly to noncompliance. The other important thing about this data view and how we perceive getting the most value is that you can really drill down into each risk factor and determine which providers are associated with each risk. You can do this simply by clicking on the risk factor. From the risk factor list on the previous slide, I clicked on a single risk factor, which in this case was CAPS pre-K billing overlap. As you can see here, I then see a map and list of all providers that are associated with that risk factors. So for this particular risk factor, which is CAPS and pre-K billing overlap, there is a rule that providers who have a state-funded pre-K program cannot bill for a full day of care for a child who is attending the pre-K program. This would be a double billing scenario, but with two different programs and funding sources. Now, in the previous manual version of the risk assessment, if I wanted to know who these providers are, I would send a data request to our IT department. And of course, they're very busy. It would take them a couple of weeks to get to that request. Once they started, they would have questions about the request, and we would have to meet to discuss their questions. They would then complete the data request, send me a data file that they had filled with their own IT jargon that I didn't understand. I would then have to meet with them to figure out how to decipher their data, and it would take a couple of more days for me to merge this data into my risk assessment. Well, with the automated risk assessment, all I have to do is click on the risk factor, and it is automatically done for me. Not only that, it contains information as recent as yesterday, which allows me to align investigations based on events occurring in real time. This is the advantage of using automation in conducting risk assessments. I have one more screenshot that I wanted to share with you. And I wanted to point out that the system allows you to filter by layering more than one scenario at a time. Sometimes the risk factor by itself may not have a lot of value, but when combined with others, it can create high impact. To illustrate this, I want to present two risk factors that, on the surface, do not seem related, but when viewed together actually have a lot of meaning. The example also resulted from a real-life investigation that we conducted several years ago, and includes risk factors called case heads working and number of children by case head. And I'll get to what those mean in just a minute. Several years ago, there was a sibling group, 3 or 4 siblings, that all attended the same provider. The siblings also had a parent that was employed by the provider. The parent's income was within the CAPS income limit, so she qualified for the CAPS program. So the parent qualified for CAPS based on income, and the children were enrolled for care at the same child care. However, we received a referral suggesting that there was something fishy going on with this provider and parent. We investigated the case and found a couple of things. Number one, the parent was not employed by the provider. Number two, the children did not attend the provider. In fact, we found that the provider colluded with the parent to defraud the CAPS program by using a scheme whereby the provider would provide false pay stubs to the parents, who then used those to qualify for the CAPS program. The parent then selected the same provider to send her kids to, who didn't really attend. The provider would then bill CAPS for these 3 kids, collect the money from CAPS, and then split the money with the parent. So while we referred this case for prosecution, our larger concern was that this type of scenario could be happening at other providers. So we decided to build a risk factor to help identify this. And so we have a factor showing case heads, which is what we call parents of children enrolled in CAPS, case heads who are employed by the provider that their kids attend. In addition, we wanted to focus primarily on those parents with multiple kids enrolled in the provider, as well as a provider that has multiple case heads employed. So while there is certainly nothing wrong with parents working for a provider, our concern was that providers were recruiting parents with many kids, more than the average of 1.8 kids per CAPS family, to participate in this scheme. So this combination of risk factors shows us where this scenario might be occurring. It doesn't mean that these cases are all fraud. We just need to be aware that these are conditions in which the fraud scheme could be occurring. So this is an example of how you can use 2 seemingly unrelated scenarios in tandem to identify providers for audit. So this was just a quick overview of the risk assessment and automation activities here in the state of Georgia. We're certainly pleased with the results that we have seen so far and look forward to using our system. We did go over a lot of information in a short time, so if anyone has any questions, we'd be happy to address them.
Thank you both so much, Ben and Ryan. Excellent presentation, so informative. I even learned more about your program this afternoon. I think having both that anecdotal information, walking through the manual, through automation, incredibly helpful for everyone. I have been looking at the time. I know we're slightly over. Only 5 people have dropped off in the past 5 minutes. But quickly, if there's questions, I'm happy to stay on. It sounds like Ben and Ryan can stay on for a few minutes. So if folks could, simply raise their hand if they have questions. I don't see any new questions that have come in to the questions box. It looks like Lisa in California, you have your hand raised, so I'm going to go ahead and unmute you. Lisa? Oh, Lisa took her hand down. Okay. Desiree in Colorado. She has her hand raised. Desiree? Okay. Sorry about that. And Jackie in Delaware. Jackie, you have your hand raised?
Oh, I didn't think I did.
Okay. I will. No problem. I'm looking through the questions again, and I'm just seeing, some thank yous, great information. I would echo all of that. Again, I apologize that we went over time today, but it's obvious that this is important information. Folks are very interested in it, so we'll definitely continue the webinar series. Our next webinar is scheduled for June 4th, same time. There's a link here to register that's also in your handouts. As always, we encourage folks to complete the evaluation, give us your thoughts, your feedback, areas you want us to cover next time. And with that, I say thank you. Thank you so much to our presenters. Thank you, Delaware. Thank you, Georgia, Ben and Ryan. Excellent presentations by everyone. I hope everyone has a good night. And again, thank you for participating this afternoon.